Hey guys, my name is Ronald. I'm a registered nurse and also a family nurse practitioner. Welcome to my channel, Nurse Track 101, where nursing lectures are made easy just for you. Well, let's get started. Now we're gonna go over the disease of thyroid. So, diseases of thyroid. Yeah, the first one, we're gonna talk about hyperthyroidism, or increased concentration of thyroid hormones in the system, in the plasma. So the first cause, the most common um, problem with hyperthyroidism is called Graves' disease. So Graves' disease, this is the most common one, and most common, and this is what happens when the body produces. This is autoimmunity, so it's just caused by malfunction of the immune system, and this is what happened when because of the autoimmunity. This is autoimmunity problem, and the body produces a thyroid stimulating immunoglobulin. So thyroid stimulating immunoglobulin. This is the antibody. This is it's called TSI. So what happened is that this TSI, it will bind to TSH receptors in the thyroid gland. So this TSI will bind to TSH receptors, and so this TSI work as if it's TSH themselves. So it will bind to TSH receptors, and as a result, it will increase the production of thyroid hormones. Yeah, this TSI usually binds about 12 hours, and the thyroid hormones just only bind for like about 1 hour. So it has high affinity to the TSH receptors. So if you have increase in thyroid hormones, then the result will be decrease in the TSH secreted, because this one will act as TSH themselves. So that's what happens. The second type of disease in the hyperthyroidism is toxic. It's called toxic nodular goiter. It could be as a single nodule. So this is like a nodule pops up in your thyroid gland. It could be a single nodule. This is a tumor. It's called toxic. The name is toxic adenoma. This is a single nodule. It could be also as a multinodular, toxic multinodular goiter. So this is a tumor in your thyroid glands, and what happened is that this is a tumor in the glands, and what happened is that this tumor will stimulate the production of thyroid hormones. So increase the production of thyroid hormones, and will in turn, as a result, you will have less production of TSH. So hypothyroidism, this is decreased production of thyroid hormones. Yeah, one of the most probably with this one, the first one is autoimmunity. Almost is the same as the hyperthyroidism, but the effect is different. So autoimmunity, or against thyroid glands, or what is called Hashimoto's disease. And with this Hashimoto disease, instead of stimulating the production of thyroid hormones, this antibody will actually destroy thyroid glands. And so as a result, you will have a decreased production of the thyroid hormones, and in turn will increase the stimulation from the pituitary gland. The second one is called endemic colloid goiter caused by iodine deficiency. So this is by dietary iodine deficiency. So some populations in the world do not have enough consumption of iodine. You have to have at least about 50 milligrams of iodine a year. It's like some people are in the mountains like Andes before the invention of iodized salt. They don't get enough iodine, so they will develop this one. So if you have iodine deficiency as a result, if you from the physiology talked earlier, if in order to produce thyroid hormone, you need to have iodine. Enough iodine you will have. So if you have less iodine, you don't make enough thyroid hormones. So as a result, you will have less production of thyroid hormones, such as the T3 and T4. And if you have less production of thyroid hormone, the negative loop feedback mechanism, it will cause an increase in TSH level, TSH in blood. So the continuous stimulation of TSH in the thyroid glands will make the glands grow in size. So it will become bigger. The thyroid gland becomes bigger. And that's what you have goiter. It's an enlargement of thyroid cells. It's called endemic because it used to happen in certain populations. So a lot of people in that population will have enlargement of thyroid gland. That's why it's called endemic. Okay, let's go back to so number 3 will be this idiopathic non-toxic goiter, colloid goiter. This has its own type because, in contrast with the second one, this one does not have iodine deficiency. And as the name implies, idiopathic, the exact cause is not known. So they also found that these people in this category, in idiopathic non-toxic colloid goiter, they have some kind of thyroiditis or inflammation of the thyroid. And they found that sometimes they also have abnormality in the enzymes that stimulate the production of thyroid hormones. So abnormality in the enzymes for the thyroid hormones. Thank you guys for watching, and I hope you enjoy this video. I also do hope that this video will help you in your studies to pursue a career in nursing. If you guys have a request about any other topics in nursing, leave a comment below. And if you guys share or like this video or subscribe to my channel, it will help me tremendously to create more of these videos. Well, I'll see you guys till next time. Bye.